We're now going to move on to our presentation of this session, the first of two. We've got a presentation now, next, and then finish off for a fireside chat before we have some food. So if we can give a warm welcome to James Freed. He's Deputy Director of the NHS Digital Academy, and he's going to be talking about digital transformation as a behaviour problem. So if we could give a welcome to James. Thank you.
Thank you very much. Thank you. Well, thank you very much for having me, first of all. It is both a pleasure and an honour to be here. So I run the Digital Academy, the NHS Digital Academy. I'm going to tell you a little bit about me and a little bit about the NHS first. Everyone's heard of the NHS, but not everyone's got the same understanding of what it is or how we do our job. Let's start with me. So for the last 8 years, I've been a jobbing Chief Information Officer in the NHS. I was CIO for Health Education England, one of the number of arm's length bodies, national bodies, that help make sure that the NHS works well. I come unusually, I suppose, for a CIO, certainly a CIO in the NHS, not from a technological background. I come from a change management background. That's what I think I am, a professional change manager. Didn't always want to be, by the way. I wanted to cure cancer. I did not succeed. But that's where I thought I was going to start. Did that for a little while. Tried my hand at a PhD, did not finish it. And then I went into the NHS in change management, and the rest, as they say, is history. I did note that both Steph and Nick also were keen to establish their geek credentials, and I'm very much looking forward to talking to you about Settlers Catan in the break, but that's a board game. To establish my alternative geek credentials, ladies and gentlemen, this feels like a bit of an Alcoholics Anonymous moment, I play Dungeons & Dragons. And there is at least one person in the room, two people in the room, who also do so. In fact, I run games. In D&D, that's called being a Dungeon Master. My 12-year-old daughter bought me a little T-shirt saying, "Daddy Dungeon Master." I showed it to my boss, and he said, "Oh." I explained. He said, "In my community, that means something different." I felt we both learned something. Anyway. Didn't think I was going to go there, did you? The NHS. So a lot of people think of the NHS as this big monolithic organisation. It is not, okay? It is lots of different, independent, and basically self-autonomous organisations. We've got 217 NHS trusts, or what we used to call hospitals. They're actually groupings of hospitals, and some of them are specialists, some of them are physical, some of them are mental health, some of them do all sorts of things, some of them are specialists, some of them are generalist. We've got 8,000 GP practices in the country. All of them run effectively as private practices in their own right. We've got 20,000 care homes, not technically part of the NHS, that's social care. 1 in 20 people in this country work for the NHS, about another 1 in 20 work in social care. 10% of people in this country work in health and social care. That's quite a big slice of the action, isn't it? And I suppose the best way to try and articulate how we work to a private sector audience, and I appreciate that you are not just private sector, is that effectively it's a franchise model. So we've got lots of different boards, lots of different chief executives who can choose to do things slightly differently. That means for each of those trusts, almost certainly each of those 217 trusts will have a different digital strategy. We're also trying to coordinate this at a national level. Oh my goodness, this is like almost the definition of herding cats. And try and write elements of digital strategy and provide elements of infrastructure that will help everyone. One of those bits is around skills to do with digital. That's my bit. And what I want to talk to you about is a little bit, I suppose, what I've learned over the last 8 or 9 years that has helped me want to make a move from being a CIO to running a digital academy. Some of the data that I've gleaned along the way. It's going to be a quick whistle stop, 8 years of learning in 15 minutes, this one. And I'm going to try and tell it through the medium of a story, if that's okay. It's not going to be a particularly good story, I apologise for that. But it will be, this is how I've learned and this is where I want to start. Is that okay? All right, that's good. So let me start with this picture. This will be very familiar to you all, I will imagine. You were saying you like a little bit of feedback. I like a bit of feedback as well. I'm not going to pick on anyone, but if you could nod or shake your head if I ask a question, that would be super, and we'll get on magic. Does this look familiar? Yes. Right, that's lots of heads nodding. Some of you will even know, oh, that looks like Moore's Law, which is kind of where it's based. But this trend has been going on since before Moore, and it's not just a technology trend. This is about the exponential trends that we see that underpin rates of change in knowledge, available knowledge, different doubling time, by the way, for all of these things. But nonetheless, there is a doubling over time. Technology, data, climate change, geopolitics. There are other trends in the world that see this exponential change over time. In technology, that rate of doubling is once every 2 years or so. And I know this isn't Moore's Law, so don't pick me up on this, but if I dumb it down a little bit, effectively what we're saying is the opportunity that digital data and technology gives us as humanity basically doubles every 2 years. That's quite a big deal. And it also means that when I was in my CIO job, it was a little bit scary because everyone thought I needed to know all about how I extract this opportunity and translate this into benefits for health and care. And I can tell you, coming from a non-technical background, that is quite an intimidating expectation. Nonetheless, let's take it as read. There's a huge amount of technology out and about, and in 2 years' time, that'll double. Is that okay as a sort of a starting, slightly dumbed down point around rate of change? So getting the value, translating that opportunity into real-world outcomes are the things that really matters, whether it be train times or whether it be user satisfaction. In health and care, we've got 4 things. It's called the quadruple aim. It's international. It's nice and easy, making things better for patients, better for the workforce, better for the public, because it's better not to get ill in the first place, and better, of course, for publicly funded services for the taxpayer, making things more productive and more effective. Now, there is a bit of a kicker. So across all industries, digital transformation doesn't always succeed. In fact, studies indicate about 70% of the time we try and undertake a digital initiative, it fails. This is not the fail fast good side. This is we've just spent 2 years, 5 years, in the case of the National Programme for IT and NHS, £12 billion, and it's not succeeded. It's not done what we thought it would do. This is an absolutely real lived experience of people who work in organizations, no matter which organization they're in. If you think about your experience of technology at home and your experience of technology at work, I can almost guarantee, maybe with the exception of 1 or 2 massive super tech giants, your experience at work is not as good as your experience at home. And it's because of this. And when you're talking about things like leader engagement and buy-in and board buy-in, bear in mind that's their experience too. So when you come and give them a business case and say it's going to be amazing, they're going to say, well, okay, that's got a 3 in 10 chance of succeeding. They're not making that decision rationally either. This is just their lived experience. It's everyone's lived experience. So the trick is dealing with that. Why do you think... I've just shown you this slide. This is the data around the causes of why digital transformations fail. About 1 in 5 of those failures are down to technology, choice of technology, or limitations of the technology. Data from Gartner, by the way, I should credit that. About 1 in 5 of them are down to resourcing issues. These are not insignificant issues, but they're not the main contender here. The biggest thing here, about 3 in 5, are cultural reasons or skills-based reasons. These are things that could be addressed by educational levers. Now you're starting to see why I like my job. So how do we do this? In fact, before I get there, let me give you some real-world data, because it's interesting to look at a survey of what, and in that case, that was a couple 160, I think, senior leaders who lead digital programs and why it's gone wrong after the event, categorized. And it's kind of difficult to try and tease that out. And what does that actually mean? This is some real-world data. There's a company called KLAS, who exists in the States. They look at health data from the implementation of electronic healthcare records or electronic patient records, EHR, EPR, that's what those acronyms stand for. Think of it as the specialized CRM for healthcare. This is all information about all patients an institution will have, including preferences, demographic details, familial details, all that sort of stuff. Everything you need as a clinician to properly serve your population. And they looked at I think that's 203 different organizations, almost certainly hospitals in the States, who have implemented an electronic health record, and then they surveyed the staff using those systems, mostly clinicians, more than 40,000 of them, as you can see. Now, each one of those bars is an organization. The longer your bar is, the better a job you have done, because the more of your staff have said, yeah, you know what, I like this system. All sorts of anecdotes about the early days of electronic healthcare record adoption in the States, but let's just use this data. If I link up the bars that use the same product, let's work this through. If the choice of product was a significant contributor to that, you'd expect them to group, wouldn't you? As it is, each of these bars, each of these arrows lines up the same product in different institutions. You can see the very bottom is mapped to the fourth highest. Simply put, the choice of technology does not have a significant impact on usability. Or rather satisfaction, not usability, satisfaction. So it must be something else. This is just some evidence to back up the cultural and skills-based thing. This is just some data from within the UK market. It's just to say that actually we're a little bit behind the States at the moment. Actually, UK clinicians think having an EPR, electronic patient record, is worse than not having an EPR in terms of usability. We're on a journey. It demonstrates to me that if I go back to my original graph around technology, I can plot something else on top, which is our ability to keep up. At some point in the relatively recent history of the human species, let's say the last 400 years, it's nice and convenient. 400 years ago is when coffee was invented. We stopped drinking beer as part of our working lives, and therefore probably did a bit more thinking and were a bit more successful in innovation. I've got no evidence to back that up, by the way. But at some point in our recent past, we were unable to keep up. We were unable to translate all the opportunity that technology gives us into actual outcomes, actual value. And as we know, technology is continuing to rise exponentially. That gap's just going to get bigger. So I think the job of educational leavers is to bend that human adaptability curve up. And that is the single biggest reason why we are not as successful as we should be, regardless of industry, in terms of translating opportunity into value. So who needs to know this stuff? All right, by the way, I wish this graph was a time series. It isn't. It's a point in time. But when I first got involved in the technology world, it was the preserve of a very, very few talented people, probably who cut their teeth by practicing in their bedrooms and their garages, right? So we are not seeing that continue. Nowadays, we see more and more people having some sort of vested interest in applying digital to do their jobs or help other people do their jobs better. So this is some relatively recent data from Gartner that demonstrates that those little segments in the blue, they're the people who are employed in the central digital functions who do digital. The bar that's in yellow on the right was called self-identified business technologists. These are people who are taking technology, often consumer technology, and applying it in their day job to do their day job better, to deliver more value. So what that means is, for someone like me, is that we no longer are talking about a subset of the population or a minority of the population that we want to try and help to do digital better. It's growing. In fact, we did some work, the Topple Review in the healthcare world, looking at digital skills in health and care, and our prediction is by 2030, 90% of the NHS will need some sort of level of relatively advanced, actually, for today's ways of working, digital skills. 41% at the moment, or that was, when was it? 2020, 3 years ago. About half in total of the people in your workforce will be digital technologists, whether you like it or not, and that's just going to grow. So everyone needs to do this. And so far, I've only talked about skills. I've only talked about capabilities. And that's not the only thing people need. And I know you were talking about psychological safety earlier. And I love the slides on that. I think it's a really important topic. If you want to be a high-performing team, there's so much information about being a high-performing team. Everyone's got their own slant. I was trying to find a sort of a comprehensive model back in 2014. I think it was UCL did some work on behavioral change. There is a lot of behavioral change models out there, and a very clever professor consolidated them all, taking the best. This is it. It's called the COM-B model. Behaviour, that's the B, is made up of three things: capability, opportunity, and motivation. I'm not going to talk too much about motivation, but my reflection is things like the agile methodologies have, it seems to me, built in a lot of things that help us drive motivation, including some of the things that help us break out of our existing habits. That automatic motivation bit. I'm not going to talk any more about motivation. I'm going to talk about capabilities, and specifically technical digital capabilities, not just technical actually, but change management or, I don't know, content assessment. That's physical capability. The psychological capability is all the stuff around psychological needs, psychological safety, being able to ask questions effectively, that sort of stuff, not feeling challenged or too challenged to be able to ask those sorts of questions or to respond. There's this bit in the middle around opportunity that we've not really talked about. 4 years ago, 5 years ago now, goodness me, we did a survey with 600 nurses in the NHS, and we asked them what would make a digitally ready NHS for them. And they said, thanks very much for talking about the AI and the shiny stuff. That's their words, by the way. What we want from you is just 4 things. Give me a decent modern-day device, with a camera and everything. Give me decent connectivity wherever I am, on the bus, in the client's home, in the hospital, GP surgery, anywhere. Give me a decent electronic patient record that I can both write to and read from. It's all the information about the people I'm serving. I need it. And fourthly, please, 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 stop writing policies that prevent me from using the first 3. Those nurses were asking for opportunity. The physical opportunity is the first 3. The social opportunity is part of that last one. And if our job is truly to try and help more and more people do more and more things with more and more technology and data and opportunity and all that sea of stuff that's out there, we need to be clever about how we provide that social opportunity, which means instead of rules, we're thinking more guardrails. Instead of prohibitions, we're talking about support and education. It's just a different way of helping people to solve the right problem in the right way rather than hitting them for doing the wrong thing. So we need all of this. And elements of this I think we can address, not all of this, by the way, but elements of this I think we can address through an education lens. Let me talk to you a little bit about the baseline as well. So I've talked about digital, and it's in its broadest sense. In the Digital Academy, we've got a number of products. Some of them are aimed at senior leaders. We've got a digital boards program that half the boards in this country have signed up to and undertaken in the first 3 years of the program, which is phenomenal. Normally, we don't get that sort of level of buy-in from what are effectively independent boards. We've got a program around digital competence and a number of fellowship programs. We've got a program specifically aimed at chief information officers and what we call chief clinical information officers as a sort of digital leadership thing. We also recognize we have a digital literacy issue. So digital literacy, our definition of it, is all those very, very basic essential skills that everyone needs to have just in order to work effectively in the 21st century. This is not my data. This is data from Lloyds Bank and a company called Future.now. And they, every year, Lloyds, you may know this, there's a digital skills index. They go out to Ipsos Mori and they poll about 5,000 people who work in our workforce. Historically, they have been Lloyds customers because they're a nice cross-section. It doesn't cover everyone, doesn't cover the homeless, for instance, or people who don't have bank accounts, but it's not bad. And they look at demographics as part of this data. You might think that the key link to digital literacy, a key correlator of digital literacy, is age. Anyone think that? I know, it's a trick question, right? No one's going to nod their head at that one. There is a correlation between age and digital literacy. There's a correlation between seniority or salary and digital literacy, even actually where you live in the country. All 3 of those are minor in comparison to the industry in which you work. That means there's something we are doing as employers, whether it be hiring practice, the way in which we work, or something a bit more insidious, like how we support staff when they come and work for us, that is a link between link with digital literacy skills. This is the very basic stuff. So just to explain the graph for a second, the inner section, the slightly darker color, is the proportion of people within that industry who have got all 20 essential digital skills for work as defined by Future.now. The people in the outside bit, the lighter colors, have got somewhere between 5 and 19 of those skills, so they've got enough probably to get by. Anyone who's not on that graph doesn't. It's got between 0 and 4 of those 20 essential digital skills for work. This is things like, and they ask very specific questions in this survey, things like, when you're using an internet browser, do you know whether it's secure or not? Or do you feel able to use collaboration tools at work? Or can you access your payslip online? Some of those are a little bit to do with the usability of the tools that we offer, almost as much as the skill base, but you get the idea. It's a very pragmatic, practical questions that people can say yes or no to. What this means for health and care, we're in the bottom 50% for a start. Oh, incidentally, for those of you who work in the technology companies, when you're looking at this, you must be feeling very smug. It's not wholly surprising. 37% of people in the NHS, or maybe I should say only 37% of people, have got all of those digital literacies. They're ready to innovate. About half have got some, but not all. And this is the real one for me. 15% don't have enough essential digital skills for work. Probably about a third of those, about 5%, about 1 in 20 of the NHS workforce, have none. They've got no digital skills at all. That means they probably can't even turn on a computer. That means I can't deliver my education through online learning tools and expect to reach 1 in 20 people. That's a significant, okay, it's a minority, but it's a significant proportion of the people who I've got to try and serve. If you're interested, this is published. All of the data that I've shown you today is published. So, very, very quickly, my goal is to try and create as many teams as possible who are both empowered, we've talked about that loads today, and have got all the right multidisciplinary skills to enable them to deliver more value more quickly. That requires supporting functions to be able to provide the right opportunity. It also requires senior leadership to provide the right culture. A user-led and data-driven culture is how I refer to it. And then we've got this concept of a skills escalator, which we need to try and develop. And we think we can probably tie this to a number of learning products, many of which exist. I guess what I'm trying to say is, for those of you who have already got skills-related programs within your organizations, I want to collaborate with you. This is a shared issue. Join something like Future.now or come and chat to me over lunch. I want to work with you. For those of you who don't, my argument is to say, I think you need to be thinking about this, and there are things that people have done already. Great thing about working in the public sector, I can make all the stuff that I do open, by the way, which I fully intend to do. So there you go. We exist to try and support as many teams as possible, because teams deliver services are there to deliver value for users, to deliver more value tomorrow than they did today, as quickly as possible. That's what I'm here for. It doesn't have the word digital in there at all. I think I've made the case that education is a significant component of that, and I think I've got the best job in the world. Thank you very much.
Thank you very much, James. We do have time for one quick question. Yep. Got there first. Thank you.
I wanted to understand your perspective on the link between digital adoption within your organisation and digital adoption for the wider population and all the patients that people will be impacting.
Yeah, so you mean digital adoption of technology, you mean physical use of technology. There absolutely is a link, of course. Thank you. God, how to answer this question? That's a tricky one, isn't it? I think there's quite a lot in there that it might be worth unpacking. So different tools have different users. Some of those tools require the facilitation of, in particular, clinical staff in order to reach patients. So, really good example. Across the two main app platforms, there are, I think, more than 700,000 health and well-being apps available. Some of them produced by reputable sources, some of them not. And we know that those apps are sorted into 3 broad categories: the ones that do good, the ones that do harm. There are some that do harm. There's a skin lesion app out there that for a while you took pictures of your genuine melanoma and it would say, don't worry about it, don't go and see a doctor. You know, there are apps out there who do harm. And then there's the vast majority that it's equivocal. Basically, it doesn't do any harm or any good. It's people pushing an app for various reasons. In those cases, we know that there is a significant barrier to adoption if your clinician hasn't recommended it. And there are some real regulatory hurdles. So I talked about the slowdown between rate of change in technology, rate of change at home, rate of change in an organization. The one that brings up the rear is rate of change in regulation. So for instance, at the moment, we don't have a regulatory framework that protects a doctor if he or she recommends to you a health and well-being app and then it harms you. So at the moment, we've kind of got to treat recommendation of apps in the same way as we treat recommendation of medicines, which is highly regulated. So we don't make anywhere near as much use of it. So there's that category of platforms and products where we need to work through educating, 700,000 clinicians in this country to make sure that they are both capable and trusting of the products that we're trying to support, because otherwise it's not going to get any uptake. There's also a whole nother set where we can go straight to patients directly. So things like the NHS app, for instance, some of you will use. You will not almost certainly have had your GP say, I think you should download this. It will have been through some other means that you will have reached it. And it's got a really high penetration, despite the fact we don't have a huge amount of training within clinical, non-clinical teams within the employee world. So it's a mixed model. I don't know if I answered your question.
Yeah.
All right, good. Thank you.
James?
Short question, long answer. Sorry about that.
That's fine. Thank you very much, James.
My pleasure.
Great presentation. Thank you.
Thank you very much.